Today, back pain remains to be one of the most common things that happen to people. In the urban society, we sit more than we do anything else throughout the day. And because of this happens to be one of the primary reasons for mechanical back pain, which means that back pain that's not coming from anything severely medical. And a lot of times back pain can be prevented very successfully by using a few tips that can help you go a long way. So in today's video, I want to talk to you about 3 simple things that you can do on a daily basis which will help you manage the back pain that you have and prevent any new back pain from starting in the first place. Hi, I'm Dr. Rajani Patil. I'm a spine and sports physiotherapist practicing for over 24 years here in Shivaji Park, Mumbai. I run a clinic called Orthosports Physiotherapy here in Shivaji Park, and here we help people overcome their pain with proper treatments, but also helping them with lifestyle corrections, posture corrections, and corrective exercises which will serve them throughout their life so that the pain doesn't keep recurring again and again. I share once a week videos on pain management, so do follow and subscribe the channel. Whole, especially lower back pain, cannot be really oversimplified by anything. It's a really complex thing because the spine itself is quite complex, and a lot of factors come into play for back pain to be managed properly. However, if I were to say the patients that I have seen in my 24 years of practice, I can safely say that back pain and knee pain actually is the next. Back pain tends to be the most common one, and sadly a lot of these things could be prevented if they just knew what to do, which is why I do preventive videos such as these. Once you do have back pain, there are some do's and don'ts that you should be doing, which your ortho or your physiotherapist, who should understand spine really well, they will guide you on do's and don'ts. That's a must. If you have red flags such as pain radiating down the leg, tingling or numbness, then this needs medical attention. This video is for people who have generalized lower back pain and you want to know how you can manage this on a day-to-day basis. So let me show you the 3 simple things that I think will help you a lot. So simple fix number 1. Generally back needs to move. Your body, your spine needs to move, and when we tend to move only in one direction, which is mostly in flexion of the spine because we slouch so much, then we restrict all the other movements of the spine, and this creates a lot of tension built up in the spine itself. And when I say spine, it can be your muscles, your ligaments, your discs. So we need to protect from that. So the first fix that I want for you is to be aware. What will you be aware of? How long are you sitting? How long at a time are you sitting continuously? How are you sitting? And in your general life, do you have enough movement built in? When I say movement, it means any movement which is through the day, not once a week. I'm talking about on a daily basis. So if you sit for say 8 hours a day, which today all work tends to be in front of the laptop and sitting, you should be getting up from your sitting position every 30 to 45 minutes. That's one, so that you don't sit continuously. The second thing to remember is to just be aware of how you're sitting. Are your feet comfortably touching the floor? Do you need to adjust your ergonomic chair? Do you need to have a better setup of where your forearms are? Is your head looking down when you are working on your laptop? Is it too much? Is your back rounded too much? Can you use a little bit of a support in your lower back so it's a little better supported? These are some things to be aware of while you're sitting and working. Where you're working also makes a big difference, right? So sitting just on the floor and working, sitting on the bed, sitting on the sofa, all these are things that cause damage not in one day but continuously over a period of time. Is just weakening your back. So if you can think about just being aware of these things, they will go a long way in helping you with that. Fix number 2, build some movement into your day. Now, when people have back pain, they think, okay, let me start building my core muscles. They'll start doing crunches. I have a lot of videos explaining to you about the myths around the core and why certain things should not be done if you already have back pain. I will link a video to that. I'll put in the description below so that you can check those out. But really, I'm talking about simple movements. If you enjoy yoga, can you do that? Can you go for walks? Can you go for a swim? On a daily basis, what is it that you can do? One simple thing that I advise my patients to do is, one is just to break your movement every time that you have a call, walk and talk. And the other thing is just stand up and do some backward bending. Because when you're sitting, it's just not possible for human beings to sit for 8 hours in perfect posture. I get that. So either use a lower back support, or you can do something called pelvic tilt corrections. So slouch, overcorrect, basically slouch and then overcorrect. So make the arch really big. This moves the spine a little bit, aligns your spine a little bit, and your body is aware in space how it's supposed to be. What is the correct way to sit? So these few things, if you build into your day, then that really, really helps. You could also do maybe first thing in the morning before you start your work. You can do a few stretches, or at the end of the day if your back is feeling tired and fatigued. Then of course you can do it at the end of the day before you sleep. There are about 4 to 5 stretches that I prefer for my patients to do, and I will again link it below. But remember, if you have any of the red flags I told you about, if you've been suffering from chronic pain, if you have acute pain that's really 5, 6 plus on the VAS scale, then you need to see a medical professional. If you need my help with this, definitely I'll put the number on the screen. We can do an online consultation, or you're welcome to the clinic to meet me. Point number 3, a quick fix for back. So when we sit for so long, what's happening is that our glutes, which is the muscle that we sit on, those just get deactivated and they become weak over time. And really, for all our functional movements, our glutes are the powerhouse that we should be using. It's the biggest muscle. And if we don't use this well, or over time it's become deactivated, what's happening is whenever you walk or you bend down to pick up something, your small muscles of the lower back get strained more than they should because the glutes are not doing the job. So one great thing to do is to just be aware of this. I know there are people who do some glute crunches, just activate the glutes while sitting, or just stand and tighten the glutes, squeeze the glutes about 30-50 times and sit back down. You can do this at the starting of the day, at the end of the day. Just build it in somewhere so that the glutes are not completely deactivated and not getting weaker with time. In fact, this is one of the primary things that I see in the clinic when I'm treating a back pain patient, that the glutes are completely not working enough, and hence the lower back gets in trouble. It's important to do some of these things as much as possible. So these 3 fixes, if you have more doubts about it, if you think one of this has helped you in the past, put it in the comments. I would love to hear from you. I also have a guide. It's called a Get Rid of Pain Fast. It's a step-by-step guide about pain. What is pain? How to scale it? How to understand your pain? And what are the simple things that you can do to make the pain go away as quickly as possible? This can be pain anywhere, but from a back perspective, because it's so common, it would be a great thing for you to follow. So just put in the comment, just put guide, and I'll send it across to you. So if you think this video was helpful to you, do share it with your friends and family, because back pain is more common than you think. People don't necessarily talk about it, so I'm sure everyone needs a little bit of help every now and then. Again, like I told you, I share a pain management video every week. Do follow this channel, subscribe, and press the bell icon, because you'll get a notification as soon as I publish a fresh video.